Training Centre, Hervey Bay. Just going to talk about insertion of an OP or oropharyngeal airway. The function of the oropharyngeal airway is in an unconscious patient is you place it inside their oral cavity and the tongue will sit here. Thereby if they lose their head tilt or you're busy doing other things, they've still got a patent and clear airway. So that's the function of an OP airway. It's an artificial airway. How do we measure it up? Well, there's various ways with this conversation. Let's go through. So first thing is people say, middle of the lip now to the angle of the jaw looks pretty good. Americans might do it that way. Some people talk the corner of the mouth. So if I went through and measured this one up, either way it looks like it's probably too big. It's going to sit high and proud. This one here, I would estimate that would be reasonably suitable. This one here looks a little bit small, so I'm going to give this one. So criteria for inserting an OP airway: unconscious, no jaw tone, no gag reflex, no fracture to the lower third. I normally use their own saliva to pre-moisten it, or a bit of lubricating gel. So we've measured it up. We've met the criteria that it's safe to proceed with an OP airway. Some people use a scissor, that's called a scissor, to open up the mouth, hit the hard palate and then rotate it around, and it should require no force to put it in. It should be just nice and gentle, sitting flush with the lips there. Then we can do a bag valve mask or no non-rebreather over the top of it. Alright, so that's pretty well the standard technique. If you don't want to put your fingers in their mouth, well, you can just do a head tilt like that and then rotate, around we go. That's to stop the tongue folding down and folding over. I did see in some places they're actually teaching just to insert that way as well, so there's a couple of different options. If they start to gag or vomit or whatever, then we've got two airways we've got to clear, so we quickly take that one out, that way to minimise any trauma, and then we've got to turn them on the side, manage their airway, suction, whatever we've got to do, finger sweeps. Then we've got two airways, so we actually have to clear that airway as well somehow. Okay. So that's just a little bit on OP airway insertion. I'll go through it again. Measure up. Unconscious, no jaw tone, no fracture.